Hi, I'm Dr. Craig Castanet. Today I'm going to talk to you about what causes neck and back pain. It's pretty simple. Um, Over time, and I'm going to use a model to demonstrate this. Over time, and let's review some of the anatomy first. I'll use these models. Um, these are low back vertebrae, and there's a disc in between here, as you probably know. This, in principle, is the same in the neck or the low back. So there are some variations with regard to pathology on the neck and back, but this is largely and conceptually consistent, both neck and back. Anyway, what we have is we have a disc in between here, between the vertebrae. The disc's function is to distribute loads, axial loads, as loads come down here from above down under the influence of gravity. This disc is compressed. It then distributes the loads and the forces to the outer peripheral fibers of the disc. There's a component inside, the nuclear component, that imbibes water, and so by redistributing the loads to the disc, it's supposed to wear in a symmetric fashion and distribute loads such. And it does a pretty good job for a lifetime, but it does tend to slowly degenerate over time. You get little microscopic tears of the fibers of the disc. The inner component doesn't imbibe water as well. It becomes dehydrated. The pressure is lost. The disc can collapse. This happens slowly over the course of a lifetime. These changes start in childhood and generally progress over the course of a lifetime under a variety of influences, including, I'm sure, genetics, nutrition, etc. In some people, this progresses at a higher rate than others. But anyway, that's what's happening. And as this disc gets compressed and these degenerative changes ensue, you get enlargement of bones in response to the increased pressure. That makes space less available for nerve roots. They're more likely to get pinched both by the disc lesions, herniations, bulges that occur, as well as the changing compromise from the bony enlargement. And this is what also causes a reduced threshold for pain provocation as you get older. This is why you don't see 50, 60-year-old people playing in the NFL. You can handle those kinds of that kind of trauma on a spine that's compromised over the course of a lifetime. Anyway, that's what's happening. And so the most effective way to treat this, which is by its nature compressive, is to decompress the spine. And the way I do that is I put them on a spinal decompression table. I secure their anatomy to it. I gently decompress this, and I've seen people get better faster than any of the means of treatment. Doesn't mean other means of treatment, conventional means of treatment, don't have their place. But I've been in practice 36 years. I spent 18 years in orthopedics, physical medicine, and physical therapy. I spent 5 years in a neurosurgical practice, learning surgical indications and procedures. I've worked with lots of physical therapists over the years, and they have good means of treatment. But I think they're missing the boat with respect to the compressive nature of this process that is essentially universal and does what I told you in terms of reducing threshold for pain provocation. This is why you see people overdoing it and they have an exacerbation of pain. Sometimes it's self-limited, sometimes it persists. And you do imaging like X-rays or MRI scan. You document these compressive lesions, whether it's disc bulge or herniation, disc collapse, enlargement of the vertebral bone or the joint, pinching of nerve roots. It's all compressive in nature. When surgery is done, they decompress you surgically, whether it's for stenosis, discectomy, or fusion. They're addressing compression. And it's also the most effective way non-surgically to address these problems is decompress the person. To do that, you need a good traction table or spinal decompression table. It does matter that it's a good table. If it's not comfortable for patients. It's not going to make the practitioner an enthusiast of using it, and you will end up doing it less than you should. Instead, as a means of treatment, you'll be shown exercises to maybe some strengthening, stretching, things like that. That's fine, but it misses an opportunity to mitigate this compressive process, which is in the background, always proceeding and lowering your threshold for pain provocation. If you want to improve your capacities, your functional capacity, and probably the natural history of your spine, decompress the spine when you have neck or back pain, and use other things as an adjunct to strengthen and prevent recurrence. But that's the most effective means of treatment I've seen in my 36 years of practice. I'm in Decatur. I offer physiotherapy. There's a distinction between physiotherapy and physical therapy. Physical therapists do physical therapy. By definition, it's a legal definition. Physiotherapy is the therapies that chiropractors do. So legally, that by legal definitions, that's what I do. We both, however, do the same things. We use physical medicine modalities, and we treat these kinds of problems. And when it comes to neck and back problems, I specialize in that using spinal decompression. As I said, it's more effective for more people, getting people faster and lasting longer than other means of treatment. So in the long run, it's also less expensive because you're doing less treatment. I'm Dr. Craig Castanet in Decatur, Georgia. My website is backstrong.net if you'd like to learn more. And if you'd like, you can go from there to my YouTube channel to watch a host of videos on neck and back related topics. Thanks so much. Bye-bye.